Thank you all for coming. It's a very exciting big day for us here in Brown County. And as I was flying out here last night, I was reflecting. It was about a year ago to this very week that Ed Green and Joan Phillips and myself rendezvoused in Cincinnati with the idea of coming out to Brown County the next day to see sort of what we were going to get ourselves into. And I think the three of us probably all came with different ideas. I think Joan was looking for what the hospital was like and what the healthcare situation was in Brown County and how she could apply her many years of background and much experience in healthcare to the situation as we understood it in Brown County. Ed, our lawyer, I think came thinking, like most lawyers do, it's a deal, maybe. And I came, in part, I must admit, as a amateur historian. I wanted to see some of the grant sites around Georgetown and around Brown County. And for the first as we drove down towards Brown County, I must admit I was thinking much more about General Grant than I was about the hospital and what adventure it was that we were going to get ourselves involved in. Just to show you how naive we were, for some reason, I picked the route 52, I think it is, that goes down along the river. And our strategy was to drive down to Ripley and come up the 68. For some reason, we never made it to Ripley. We headed up over the countryside between the river and Georgetown and got lost. And I think we were about an hour late for our first meeting here. But after we got here and after I went and saw my grant stuff that I wanted to see, we did come over to the hospital and start to involve ourselves in learning about the hospital and about Brown County. And we learned a lot about the people of Brown County. And they're hardworking people. They're people who care about their families. They're people who care a lot about each other. People who are worried about the future. And they're people who, in caring about each other, almost 60 years ago, I think 60 years next year, decided to build a hospital system and put together a healthcare system to help take care of each other's health needs in Brown County. We were very impressed with the clinics that surrounded the hospitals in various parts of the county. And we were very impressed with the love and the attention that you could tell went into the building of this hospital and the operation of this hospital over many, many years. As the months went by, a lot happened. And by June of this year, we finally were able to close a deal with the county commissioners and with the board to buy the hospital. And at the time we bought the hospital, a lot of people asked what we saw was one of the biggest challenges facing us. And there are lots of challenges then, and there still are lots of challenges and lots of problems. But the biggest problem at that time in June, and still the biggest problem, is that a lot of people in Brown County, for a lot of different reasons, have elected to basically leave Brown County for their health care needs and to go to some of the larger hospitals in Cincinnati and in neighboring counties. A lot of folks, for one reason or another, gave up on this hospital. But today is a big day, I think. A lot of folks haven't given up on this hospital, and I look to today as basically the first day in a new beginning and a new kind of hospital here in Brown County. One that we believe, given time, will attract back to Brown County many of the people who, for one reason or another, are leaving Brown County for their health care. We have two big announcements to make today. First, we're changing the name of Brown County General Hospital to Southwest Regional Medical Center. And second, and most importantly, we are proud and happy and thrilled to announce today that the hospital is becoming an affiliate with the Christ Hospital in Cincinnati, and that in this affiliation agreement, the Christ Hospital and the new Southwest Regional Medical Center will work together to hopefully be more responsive to the healthcare needs of the county, and will work together to provide a new day for healthcare in Brown County. Why the changes? The name change, first of all, the Brown County General Hospital provided lots of health care, not just to citizens of Brown County, but it provided lots of health care through its clinics, for example, in Bethel, to outlying counties and counties that surround Brown County, and provides lots of health care to our friends in northern Kentucky. And we think that the concept of a regional medical center is more reflective of what it is that we want to do with Christ in developing for this entire area, not just Brown County, a regional, rural/suburban medical center that can provide and meet the needs of everyone in the region. Secondly, we think a new name is emblematic of it being a new day for healthcare, and a new day for healthcare in Brown County. And thirdly, and personally, I live in Arizona, and I'm used to seeing lots of sunshine. And when I come to Brown County, over the past year, I haven't seen much sunshine. And so now I know whenever I drive up to the hospital, the first thing I'm going to see on the sign is the sunshine, and that's going to make me feel better. Why the affiliation? There are a couple sayings that come to mind. First of all, there's the saying, if you can't lick them, join them. And there is no way that as a freestanding hospital, no matter how much money, how much energy, how much time we put into it, that our little hospital would be able to compete with some of the major medical centers that are located just up the road in Cincinnati. Be a little ecumenical here. If Mohammed won't go to the mountain, bring the mountain to Mohammed. And basically, what we're doing through this affiliation agreement is having one of the premier, the best hospital in Cincinnati come to Brown County to help us provide better health care in Brown County. The last question is, why did we select the Christ Hospital to affiliate with? I remember in January this year, before we even signed a letter of intent, that Tim Prawley, who's here with us today from the Christ Hospital, contacted me and asked me if we could meet and have dinner and talk about what it was that we saw the problems were in Brown County, and how perhaps in the future the Christ Hospital could work with us to improve the delivery system of healthcare here. And several months later, Joan had been meeting with Susan, and we got to meet with Susan and her team, Tim and Vic and Heather, who I've just got to know. And I could just tell, sometimes you just tell in your gut, how much the people at the Christ Hospital care about people in Brown County, and how important it is to them that Brown County become a part of their healthcare network and part of their vision and dream. And it's a wonderful vision and dream about healthcare in the 21st century. So that's why we changed the name. That's why we're affiliating. And best of all, that's why we're affiliating with the Christ Hospital. Now I'm going to introduce Joan, who all of you know probably better than you know me, but Joan's going to talk a little bit about some of the details of the affiliation, and then we're going to let Susan talk a little bit. Thank you.
Well, is everyone excited today?
Yes.
That's good. A little bit louder. First of all, I wanted to thank Susan and her team for coming today and for honoring us with this wonderful occasion. Second of all, which I really should have done it first, was to thank Paul for his vision in being able to get us to this point. As he said, it was 6 months ago that we finally purchased the hospital after all of the different routes that we took coming to the hospital during our during the times that we were looking and doing our discussions with the board and with the commissioners. It was really interesting because we thought we were in kind of no man's land, but you all know that. But today, look at who we have here. We not only have Christ Hospital, who all of you have told me has nothing but the epitome of quality in their reputation. And second of all, we have with us people from the board. And Eric, it's nice to see you and the others. We have our medical staff. We have the commissioners. We have our neighbors of the nursing homes and the ambulance people. And all of you who really have helped make this happen. And so you are the people that also need to be honored today, because without all of you, this day would not be here. And I know it's been a struggle for many of you because it's just been a very different model, it's been a different approach. But when I came here, I shared with you what my interest was. Yes, we are a business and we have to be a business. It's prudent because that's how we survive. But healthcare to me is so important because I believe that it is the most vulnerable time of anyone's life when they are ill, both for the family as well as for the patient. And when I see people having to drive an hour away to get health care, it just hurts my heart. And you know I like to speak from the heart. That's who I am. That is one of the reasons why we were looking at how do we keep Brown County close to home, but how do we bring the most sophisticated, best practices, and highly qualified personnel to Brown County to be able to provide the services for all of you. I went out to the community after being here a short time to try and find out, what did you want? What did you want here? And you told me basically three things. You said you would like quality. That was number one. You understood what quality was from the past, and you wanted quality to come back to this hospital. You were concerned. Second of all, you told me you wanted a person who was able to provide high quality of care, who had that compassion, who paid attention to the patient satisfaction, and who was caring. But yet they needed to have that expertise. Did we have the expertise here anymore because people were leaving? And third, you did say you would like to have health care close to home. That yes, that drive does get to you many times. So as we started to look at where would we be able to go to put that kind of a picture together, it was a very natural move to start looking at Christ Hospital. Because you all told me again that Christ Hospital was known for quality. And from all of your dealings in the past and the reputation of Christ, that's what you believe this community felt, that Christ Hospital was the quality hospital. Those are your words. So again, I don't know if you know that, Susan, but that is what the community thinks of Christ Hospital. And we're very happy to be able to say that to you today. Be able to work with Christ Hospital in a collaborative way. And they have already spoken to us about being able to utilize resources, to come up with best practices. I mean, these are all terms that you have been hearing over the last 6 months. Let's look at best practices. Let's have credentialing for our staff to be able to demonstrate that we are going to be best in our service line. And on a daily basis, I mean, or not a daily basis, basically a weekly basis or so, we always have someone from Christ calling. Tim. I mean, Tim, you've been a rock, you know, calling and being there and supporting and encouraging us to move forward. And in meeting Vic, it was very pleasant for us to be able to see the knowledge and the thinking capacity that Christ has. So I believe that we are here today to be able to offer you, as Paul said, a brighter future, to provide for you the resources that are going to help us get to that next level that we've been talking about, where we will become more of a highly credentialed and expert hospital, being able to be seen and recognized not only through our outcomes, but through our credentials and through the people that we serve when they come back and say that quality is here. So again, thank you very much, and we look forward to a wonderful next year and more of the same. Thank you. I would like to introduce Susan Krusher.
Thank you, Joan and Paul. There is no way I'll approach their eloquence, so I'm just really, really impressed. And it was so wonderful to hear the visioning part and the journey, again, that Southwest Regional Medical Center has been on. I can tell you that the Christ Hospital team are so honored to be here today, and how impressed to see this wonderful turnout. Honestly, driving up here, we thought, oh, maybe there'll be 5 or 10 people. Like, we were really excited, but there's a whole room full of folks, which again just speaks to, I think, the energy and vibrancy that Southwest Regional now has. So we're really honored to be here to share this very positive news for the community. And through our collaboration and dedication to our mutual missions of caring, the Christ Hospital, which includes our physician network and network of services, and Southwest Regional Medical Center are going to now work together to, again, hopefully improve the health of our region here in Brown County. Our affiliation is going to allow us to impact many of the demands that are placed on healthcare providers by collectively working together to improve quality of care, also helping to reduce the cost of care and expand access, which we know is so important to the patient's overall experience. Our partnership is part of the Christ Hospital's long-term vision of serving a wide geographic area with our tertiary care services and looking at that whole continuum of care that patients need throughout their life. And also doing that at a local level through collaborative efforts such as what we're doing today. And we also want to make sure that we will work together to set mutual goals that meet the needs of the community. We're going to work on numerous clinical integration projects and strategies, things such as disease management protocols. And we're going to share our medical protocols that we have and our best practices, as well as access to some of the finest and world-class physicians that we have and our specialists as well in services like cardiology, oncology, and orthopedic services. We're also going to work together on an operational level for many improvements, hopefully, that we can do together that will bring a higher level of care as well as increased access to the region. And we also have a research institute at the hospital, the Lindner Center for Research and Education, which again, we have a lot of patient protocols that we can bring to this area as well. However, one of the things we know that we most value in this partnership, again, is the commitment of the employees of Southwest Regional Medical Center and the dedication that the employees have to serving this community, as well as their families and friends in the neighborhood, et cetera. And it's that demonstrated commitment that we believe will be the true value of this overall partnership. And so again, from the Christ Hospital, we are just so excited and honored to be part of the new journey of Southwest Regional Medical Center. Thank you.
And one last piece in honor of Eric, who taught me the public display of signing of documents. I thought we would actually sign the master affiliation agreement in front of the crowd today. So I've got the two agreements here signed, are ready to be signed, and I'm going to ask Paul and Susan to come up here and ceremonially sign these agreements. And I don't know where Eric is at, but I did learn this from you. There you go. Thank you. With that,
you know, and I'm remiss, but I would like to thank our medical staff for coming. And Dr. McKinley, I was wondering if you would just like to say a few words on behalf of the medical staff.
There's nothing like an impromptu speech. And I don't have anything prepared, but being a lifelong resident of Brown County, it is very important that we take care of our own. And that's something that we have strived to do. There have been challenges that we have tried to meet and overcome. And with Joan's guidance on site and the help of Ed and Paul at the corporate level, we are overcoming those challenges. It doesn't mean that they are all handled at this point, but we are making strides. And you know, since this group has come, one of the things that I have noticed is the feedback that's coming from the patients and the folks that are utilizing this hospital now. I am hearing more positive comments about the services in this hospital and in the offices than I've heard in some time, and I've been back with the organization now since 2005. So this is a step in the right direction. It's the right foundation. We are so excited to have the folks from Christ who have been affiliated in various levels in the past in this county, and all of us that have more gray hair would remember that. But I see this as a more formalized step. I think there are exciting plans and wonderful opportunities. I too want to thank that medical staff as well as our employees who have really hung in there with us. Again, it's been a challenge, but it's getting there. And just hang in there. Good things are ahead. Thanks for the opportunity.